So let's quickly think about diagnosing osteoarthritis, just to kind of make sure we're all on the same page. So I think often we kind of jump to the conclusion, maybe without thinking a little bit further. And if anyone was at my lecture yesterday, you might pick some of these. Okay, so here's a dog that's come in pretty lame. It's had a cruciate surgery previously, and it's become more lame again. It will put its foot down, but it's pretty much doesn't want to weight bear. Does this dog have osteoarthritis? Yeah, of course it has osteoarthritis. It's had a cruciate surgery. It's got a cruciate rupture, so it's going to have osteoarthritis no matter what. Is that why it's lame? Most dogs with osteoarthritis are not that lame. So this dog actually had ruptured its meniscus, and it had been doing better than this, and then ruptured its meniscus and went acutely lame again. Just needed its meniscus removed. Okay, what about this dog? Also had a cruciate surgery. Has to have osteoarthritis because it's already damaged its joint. If you remember yesterday, this dog actually had a septic arthritis. So, we tapped that joint and had to treat it for septic arthritis. So it's no point just treating it because it's got osteoarthritis. You've got to differentiate if there's other issues going on for that animal, because sometimes it might change how you manage them. Okay, what about this dog? Does this dog, do you think, have osteoarthritis? It doesn't want to walk very well. It's reluctant to walk. Anybody want to comment? It may well have osteoarthritis. The dog's about 9, doesn't seem to want to walk. But I don't know if you noticed when it was walking around, it has proprioceptive deficits. So that dog actually has a neurological problem, turned out to have an intervertebral disc disease. It probably had osteoarthritis as well, but we need to manage its intervertebral disc disease first. So it's important to differentiate if there's other issues. Okay, another common problem is that we might miss a bone tumour. So we might, for instance, have a lame dog come in, and it probably does have osteoarthritis or even cruciate rupture or something like that. But without radiographs, you might miss that there's also a primary bone tumour there. So look for the second thing that they might have, because you don't want to just be managing the OA, missing something else that's significant. Okay, we don't see too many cats. Here's a cat that's lame. Is this osteoarthritis? Go on, move. Do you find it's really hard to do lameness exams on cats because they don't walk? And they just go. Walk, go on. Okay, so this cat there, has proprioceptive deficit in its left hind leg. So this cat actually had an arachnoid cyst, which is like a fluid-filled pocket, cystic change within its spinal cord that was putting pressure on its spine. We did surgery on that cat, and the cat then walked normally for about 3 years or so, and then developed it again. When we did it again, the cat did fine again. But that's a bit unusual. But again, important to differentiate it for osteoarthritis. Okay, here's another one. Okay, this is really sad. I find it sad. Have a look at this. This dog does not want to walk. It does not want to walk so much that it'll fall on its nose. Oh. It's so sad. I look at that dog and I immediately think, gosh, this dog's going to have a polyarthropathy or something. It's that, that I don't want to walk on a hot tin roof kind of look. It's really sad. Okay, so does this dog have osteoarthritis? Doesn't look neurological, does it? It's not actually knuckling, just doesn't want to stand. Okay. Anybody, can you see that clearly enough? Anybody want to comment on what they think that is? You don't see it too often. I had one the other day. I can hear whisperings. Hypertrophic pulmonary osteopathy or hypertrophic osteopathy. Does anybody remember seeing that? Maybe in your just student days. They do happen. That dog had a pulmonary mass. If you remove the pulmonary mass, usually you can get regression of those signs and the dog feels good again. Depending on what the pulmonary mass is, you may or may not have a great long-term prognosis. The last one I had, which was not that long ago, actually had osteosarcoma removed. I had done an amputation something like 2 years previously in a shepherd, I think it was, and it came in really, really painful in its remaining 3 legs, didn't want to walk. And I CT'd it, because now we have CT, you can get much better images. All its pelvis, all its long bones, everything had those changes. Really, really sore. And it had this pulmonary met. Not a good prognosis for that one, but sometimes you can get good results. Okay, another one. Presented with acute lameness. What do we think about this? Doesn't look neurological, it's not knuckling, it's definitely lame on that left hind. This dog has a cruciate rupture, okay? Does it have osteoarthritis? If it doesn't, it's going to. And I think the critical thing is, knowing this dog's going to have a problem, you want to start educating the owner right now, because whatever happens, that dog's going to need long-term management for osteoarthritis, whether you do surgery or whatever. You need to start educating the client about osteoarthritis management now, whether it has changes yet or not. Okay, so what about, this is an old dog that presented to me. This dog is blind, if you're wondering why when it gets up it looks like it's going to walk into things. It's completely blind, which is not its problem. It presented to me because it had difficulty rising, possibly because it was morbidly obese. The owner, who's a lovely guy, and I've known over many years, had great problems because his father has dementia and he was living with his father, and the father would just feed the dog, so often. I find that really difficult. How can you help somebody who's living with somebody with dementia that's feeding the dog when they're not there? So that's tricky, but anyway, does this dog have osteoarthritis? Well, I don't know, but we radiographed him and he did have signs of osteoarthritis, but he actually turned out to also have a medical problem, and he was referred to medicine. But the point, I guess, is that yes, he has arthritis. Yes, we can help him probably with weight loss, but some dogs are trickier to manage than others depending on the home situation. Okay, any questions so far? This is just the reason why maybe I'm interested in arthritis, because that's my daughter skiing. She has skied World Cup for Australia in moguls, and that's probably pretty stressful for your joints. Okay, all right, let's keep moving. So I talked about this case actually yesterday, but I didn't show as many slides. So this is Henry. Henry, I think, is the one with the red hat on, pink hat on, whatever it is. That's the second birthday party, I think, with his brother Fred and George. Henry's owned by a good client of mine. So he originally presented to me when he was 1 with his brother for conformational problems, and apparently a left head tilt that they both contracted. But anyway, they were presented because the owner was worried about their hind leg conformation. So look how upright the hocks are. That dog does not stand well. It's really, really straight in its hock, and same with the other one, you just can't see behind. So the owner was just worried because the conformation wasn't good. They weren't lame. They were very upright though. It wasn't a positive Ortolani on palpation. And they did have some skin problems. They saw a dermatologist for that. So we took some radiographs, and these are just a sample. I didn't take I didn't show you all the radiographs we took. But we checked out for osteoarthritis, so there was no problem, significant problem in the elbows. What do you think about the hips? Are they subluxated? Yeah, they're subluxating. They're not really bad, but they're not perfect hips. Is this dog going to develop osteoarthritis? Yep. When do we start talking about OA care for its owner? Now. Yeah, absolutely. So this dog doesn't have any clinical signs, but we know it's going to have a problem with down the track. Here's one of its hocks. It doesn't, apart from the uprightness, doesn't actually have any changes in the hock. There's no OCD or osteoarthritis. So yes, this dog does have the propensity to develop osteoarthritis because of its, at least in its hips, because of its change. So what do I do now? Yes, I do management, because I'm now talking to them about osteoarthritis management. So I started, this is before we had Metabolic Plus. So I started these dogs on JD, and I also started them on a course of pentosan polysulfate, and I particularly, as I mentioned yesterday, although not sponsored by them today, do recommend Zydax over any of the other pentosan products, just because of the sulfation level is between 18 to 20%, not down at 14%, and you get much more consistent levels of response because it's a consistent product. And they're the only ones who've got FDA approval and done double-blinded, multicentric, disciplined, placebo-controlled trials to get it passed in the States. So definitely use a pentosan polysulfate product. I did start physiotherapy in these dogs. I discussed weight control, weight management, because that's a big problem in the large breed dogs. So we had a chat about what they should be. Okay, and then we repeated the course 12 months later. I usually repeat the course rather than doing monthly ones, as some people do. I like to repeat the whole course, maybe every 6 to 12 months, something like that. And the dog's doing fine. They were running around, playing ball, looking good, no problems. Okay, Henry comes in, sudden onset, left hind leg lameness. you probably know the rest of the story if you were at my talk yesterday. So he presented at 80-something kilos. Obviously, the weight management talk didn't go down so well because they forgot that bit, and he was 85 kilos. So I thought he was stifle lame, but I couldn't actually get instability. I did do some radiographs, and there was a bit of joint effusion. I thought, the joints probably got a little bit of change in that. If you look in the patella, there's a little bit of change maybe kind of on the patella here. But I still couldn't get a positive draw on that day. So we treated the dog conservatively. I took his hip radiographs again because I was interested. If you remember back at 12 months of age, he's now 2.5. Do I think the hips have changed significantly? No, actually pretty good. I don't know if that's anything to do with what I did, but I thought that was cool, but his hips hadn't got any worse. Okay, so dog comes back a few days later, didn't get any better. Owners are really concerned. It's insured, so we go for an MRI because I can. And if you remember rightly, yesterday I showed these images. So we have the advantage in a really big dog of getting the diagnosis. Can you see my, so here's the intact caudal cruciate and cranial cruciate is missing. On the other view, we can see the menisci really well if I get it in the right plane. So we can see intact menisci on both sides. And that's really helpful to know what I'm dealing with before we go into surgery. So we have a high field MRI, which makes it much easier to get images like that. You can't really image joints very well on a low field MRI. We get our images pretty quickly. It's really good for spines, brains, soft tissue, joints. Even if we had to do an MRI post-surgery, because I'm using titanium implants, we can still do that. It doesn't interfere significantly with the imaging. Okay, so I went to surgery, had a TTA, because that's what I do. Did well. Okay, so now I'm just going to talk about how do I manage arthritis. So this is kind of what the crux of what I tell everybody with osteoarthritis. I give them this plan. So you might need to use intermittent non-steroidals. Obviously, if it has surgery, we're going to use those. We've got blood work to tell us it's okay to use those. But that's kind of part of the mainstay. And they need to know ongoing. They might need to use intermittent use of non-steroidals. And I don't care which ones you use, well, as long as you use one of the new ones. I don't care, whether you use carprofen, meloxicam, Previcox, Onsior. I use all of them. If the animal's been on it, it works well. If they like liquid, if they like chewables, if they like different administrative style, depending on their weight, sometimes one works better. So I'm happy to use all of them. I have to say I prefer the 24-hour lasting ones because I think compliance is a problem. And then when you go to once a day for a 12-hour functional non-steroidal, I don't think it gives as good a coverage. So I do tend to go for a 24-hour release one. But anyway, non-steroidals, weight management, huge thing. This is probably the biggest thing that I talk to every client about. I feel like I talked till I'm blue in my face about weight management. And if you don't give them a target weight, it's not going to happen. So if you go, yeah, your dog's a bit overweight, that's the last thing you say, that's all, they're just not going to do anything about it. If you go, your dog's 30 kilos, it should be 20 kilos. We're going to make a plan, I want you to stick to it, we're going to have regular weights, they're going to come back to your clinic and be weighed, you're going to keep a record of this, they're going to feel kind of guilty if it's not working. So you need to give them some target weight and how to do it. So you need to give them the diet, the amount that they have to feed, and then check it regularly. If you don't have it written down in black and white for those owners, they will not follow it. But if they do, and you do it like that, they get really excited when the dog loses weight, and they can see a difference in their dog. Absolutely worth doing. Okay, exercise management. Obviously, if they've had surgery, you've got to modify that depending on whether they've had surgery or not. And we give very specific recommendations on how much exercise they can do. So with a TTA, I don't want them to be in a cage. I want them to be walking. I just don't want them running and jumping. So we have kind of restricted activity, avoiding running and jumping, lead walks only, not too far, that sort of thing. So we give them very specific recommendations in writing. I recommend them seeing our physiotherapists, and we have a couple of those. And they have a specific physiotherapy plan that they take home. I mentioned Zydex, and I definitely would repeat that. And I think it reduces the amount of non-steroidals that you need longer term. And you can start that pentosan polysulfate injection before they go home if they're in for 24 hours at least. So you don't want to give the injection within the 24-hour period because it has a heparin-like effect on the day of surgery. Potentially that could be a bleeding issue. But as long as you wait 24 hours, you can use it before they go home, and then you can give the next one at suture removal, so kind of get 2 out of the way quite quickly, easily, because the owner's already in there. I definitely use some sort of nutraceutical, whether it's in the diet or whether you give it separately. And sometimes you have no choice if they're already on a specific diet because they have sensitive stomach or something and they need to have a certain diet. You might have to use a nutraceutical added to it. But you want one that, and there's a huge number out there, but you want to have glucosamine, chondroitin, omega-3 fatty acids. You want to have a combination at the right dose levels. So not all oils are oils. You've got to look at that. Appropriate bedding, maybe that's a little over the top, but something warm and off the floor, and they're not going to get cold, but easy for them to get onto. They don't have to jump too far. And then I'm certainly not averse to using adjunctive therapy. I don't understand why it might work, but I have had dogs that have benefited from having acupuncture, for instance. So if you're into that sort of thing, or your patient's happy to do it, or your client's happy to do it, I think it can make a difference to the patient. Okay, so how did Henry go? He was back playing ball again, very happy, and I'm just waiting for the next knee to go.